Good afternoon, everyone. Let's see here. All right, so there have been 82,954 total cases and 1,630 deaths. As you all are very well aware of, our case positivity has drastically increased over the last couple of weeks. Obviously, the presence of the Omicron variant as well as holiday travel has induced this. At this time, daily cases are around 60% higher than they were during the Delta peak occurring at the end of July, early August. And we haven't seen that same increase, though, in hospitalizations, but I'll discuss that in a few slides. So this is a community transmission map reflecting data from Thursday, December 23rd to Wednesday, December 29th. Nationally, cases are increasing rapidly, but this time, again, hospitalizations are increasing incrementally and deaths are pretty stable. So this does suggest that, as everyone has heard, that the Omicron infection may result in milder illnesses. And it's also important to point out that we do know hospitalization lags a little. So as we see these cases go up, we probably will see the hospitalization data come in behind. But even still, at this point in this surge, if this was anything close to Delta, we would have seen a significant increase by this time in that hospitalization numbers. Last week, we were averaging over 900 cases per day here in Volusia with a 7-day case rate of 713.2 cases per 100,000 population, which is about 7 times higher than that threshold for high. So that is like our record in terms of the case rate. This week will likely be above 1,000 for that case rate. But we'll talk about where we're likely headed in a couple slides as well. The state is at 1,358 cases per 100,000 population, and the country is at 669. So vaccination rates, we see the demand that's pretty stabilized at this point. Obviously, we've been at 64% for a while. We're still, last week, and we administered, by we, I mean the county, 1,525 vaccinations. But again, that's kind of keeping it stable. There's not a whole lot of folks getting vaccinated for the first time at this point. Booster recommendations were also expanded 2 weeks ago to include 16 to 17-year-olds. And then last week, Pfizer was expanded, or they expanded their recommendations to include 12-year-olds and up. So this projection was created by the Institute of Health Metrics and Evaluation. It aligns with what researchers have kind of created at University of South Florida as well as University of Florida. The estimated number of infections are the number of people the researchers estimate are infected with COVID-19 each day, including those who have not tested. Based on modeling projections, case numbers will likely continue to increase over the next few weeks and then drop off as rapidly as they rose. If you look at this graph, we're actually further along on this peak because right now we're significantly higher than we were in August. But if you look in the beginning of January, it has us somewhere around there. So it's likely that we're closer to the peak than what was originally projected, which is good news. So this graph predicts the projected use of hospital resources for the state. Again, they show this as lagging slightly behind of where they saw the peak, but of course, not really coming anywhere near with what we saw back in August and September. And then this graph predicts daily deaths, which as of now is predicted that this data point will be only minimally impacted. So the number of new hospital admissions has more than doubled during the 7-day period listed on this slide. And then since December 28th, new admissions have doubled again. I know this sounds like it's contradicting what I just said on the last few slides because hospitalizations are rising. However, if we look at this in relation to the case rate, these numbers are low. The percent of beds used is increasing as well, but also remains relatively low compared to the hospital resources that were once required. The relatively low hospitalization numbers we're seeing now, again, possibly related to data lag, but are likely, it's just the result of Omicron, is not as severe. The number of residents visiting our EDs and urgent cares reporting COVID symptoms has also increased over the last few weeks. The last 7 days, we averaged around 172, and I would say toward the beginning of December, we were averaging around 40. So that is a significant increase in a burden on the emergency departments and urgent cares, as Kevin Captain just mentioned. That's why we're encouraging folks not to go there unless you actually need emergency treatment. However, even still, back in August, those numbers were around 240 a day. So we're not at that point. So most of this is pretty good news concerning the Omicron variant. There's been a lot on the news in terms of its severity. They're looking at other countries, and then we can tell that that we're not. It's not as severe as what we projected or experienced in the past. So that's good news in that we're probably moving quickly towards a phase where this is considered an endemic illness. There has been, and this is true, Omicron is very similar to the cold, very similar, your symptoms are very similar to the common cold, but it is important to note one of the differences is in this variant, it is still much more transmissible, and then it also still impacts some individuals and impacts the hospital system, obviously at a greater rate than what the cold would. So that's where we are with that. I did want to add an extra slide with the quarantine and isolation, and I would say I apologize, but I mean, I didn't create the quarantine and isolation guidelines. It does keep changing, and so I did want to inform the council what is most up to date. So currently, well, first let me start with quarantine references the time and behavior following the exposure of a virus versus isolation is the time and behavior after you have tested positive. So those recommendations are different for that time period. If you've been exposed or are considered a close contact, it's now recommended that you quarantine for 5 days instead of the initial 10, and then continue to wear your mask around others for 5 additional days. If you've been vaccinated within 6 or 2 months, depending on which vaccine you received, then it's not recommended that you need to quarantine in the new guidance. However, if you've tested positive, it doesn't matter if you've been vaccinated or have natural immunity, it's still recommended that you isolate for 5 days and then wear your mask for 5 days following. Now, there was some controversy recently regarding testing out of isolation with this new CDC update. So CDC came back and did update the guidance again, not requiring a test to test out of isolation, but saying that someone could do that. At the end of the day, this was based off of that infectious period that people are most likely to infect others during those 2 days prior to symptoms or the 2 days afterwards. So it really doesn't make sense to require that test at that point, not to mention the present burden on the testing system. So what's really important at this time is just folks making sure that they stay home when they are sick. That's one of the most important things we can do when we're in the peak at this point. So at the health department, we continue to provide COVID-19 vaccines at all 4 of our office locations. We're also providing vaccines and education at community events, but over the past couple of weeks and then over, I guess, while we're still in this peak, there may be some delays. And we have heard that from community members with us being able to schedule the time to get out there just because of all the things we're trying to address. We have increased our testing capacity at the health department as much as our staff can accommodate. Prior to this peak, we were probably only like 14 folks on our schedule, and this past week it was about 100 a day. So we're really stretching at this point to assist with, of course, there's multiple testing sites at this point, but we know, we tell the folks in the community it is going to be a wait, and that unfortunately that's the case across the country right now. In regards to testing kits, that's also been a question. We've provided 38,000 testing kits to Volusia County schools, 800 testing kits to Volusia County charter schools, and I believe around 2,000 to our first responders. And then we have also given 5,000 to Family Health Source to help support their distribution efforts with the testing kits. And we've requested from the state some additional kits, and our plan for those is to help support our long-term care facilities as well as first responder organizations. Today, Family Health Source is actually distributing test kits, or were, between 9 and 3 o'clock at 2 locations, one in Daytona Beach across from the old DMV, and then also in DeBerry at the Bill Keller Park. In addition to vaccination and testing, Family Health Source is one of the monoclonal antibody treatment providers in the area. They're providing the treatment by appointment only at Daytona Beach and in Deltona. Again, the wait, when you call, there may be a wait to get in because, as everyone has seen on national and state news, there has been a problem with supply of that treatment. At the governor's press conference earlier this week, it seemed as though that had been mitigated, so that treatment may be coming down more, it may be more available, more easily available soon. However, hopefully, if these projections are correct, we won't be in this peak for as long. The COVID-19 antivirals have also been approved for emergency use, and they will be pushed down through local pharmacies. Again, it is unlikely that the antivirals will be available in local pharmacies prior to the end of this peak, though. However, that is really good news in terms of us moving into an endemic phase of the disease and the pandemic. And then, let's see, regarding case investigations, at this point, it's impossible for us to investigate every positive COVID case. So CDC is recommending that we emphasize or prioritize individuals in high-risk congregate settings like long-term care facilities or jails, prisons, as well as individuals who are just at increased risk for severe COVID-19. And then lastly, last time I was here, there was some questions regarding flu transmission. So during the last 4 weeks, the percent of influenza positive laboratory results did remain low, but they're continuing to increase. The relatively low rates of flu transmission are likely underreported due to the high reporting of COVID-19 and the low level of testing for flu. So the flu is actually probably more prevalent than is actually being reported. And then that's something else, and this is the last thing I'll say, I'll be done. There has been some inquiries that we've received and we've seen online with the confusion with the PCR test, flu, and COVID-19. So most of this, well, first I'll start by saying the PCR test is still considered the gold standard for testing for flu. It's considered the gold standard for testing for COVID-19. It was developed to test for the presence of a nucleic acid that's specific to the novel coronavirus. So it'd be really difficult for the PCR test to mistaken COVID-19 for flu. However, the reason that so much confusion is circulating is because of the communication gap. And I believe it was July 21st, CDC issued a lab alert. And in the lab alert, what they said was they wouldn't be reapplying for the emergency use authorization of the PCR because it is unable to detect flu. And they may, I believe, and I don't have it printed out in front of me, they might have even said it can't differentiate flu, is what the wording was used. So what was confusing about that was what it implied was it can't tell the difference. But what the intention is that there is a PCR test that is widely used that is able to detect both flu and COVID-19 and is the preferable test moving into an endemic phase, especially to preserve resources and time. Next fall, flu season comes around, we should be able to test for both. I've also seen reports of co-infection, people with both flu and COVID. So at this time, that wasn't the intention of that lab report that was released. And at this time, they are still saying that PCR is the gold standard. But what would likely happen in the future is that all those tests that are testing for COVID, they will be testing for both, versus the one that's widely used now does not have the ability to test for flu. It can only test for COVID, the one that's being used widely and the one that the emergency use authorization was granted for. Other than that, I'm sorry that was a lot, but that's it.